May is Mental Health Awareness Month, a time to become more aware of the mental health challenges facing society as a whole and perhaps how it is or can impact you. We've seen the tragic instances where someone having a mental health break is shot and killed while being aggressive toward police, but that is not the norm for mental health issues. Joining me this morning is Audrey Omenson, the clinical director at the Nick Finnegan Counseling Center. Good morning, Audrey. Let's talk about mental health issues. We talked about this yesterday when we spoke a little bit. It's much more than that crisis, is it not? I mean, we think about mental health, it's a broader topic.
Absolutely, yeah. There's, of course, these tragic worst-case scenarios where someone really hits something, a really dramatic point. But yeah, most mental health struggles aren't that. There's a whole range of what this can look like. There can be active mental health challenges, anxiety, depression, panic attacks, addictions, like those types of things. There can also be times where maybe there's not anything actively going on. We just feel blah in life. Like, it's like, oh, I'm tired. Like, I don't have a lot of motivation. I don't know. You know, it's not anything diagnosable, but still is a struggle. And then there can be times in our life where we really feel like we're flourishing and thriving and doing really well. It's not that thriving is the goal all the time. That's not possible. It's acknowledging, mental health is acknowledging that there's going to be fluctuations throughout our whole life. And what do we do when those fluctuations inevitably happen? And how can we support ourselves and support the people we care about to transition out of the challenges? Yeah.
And Mental Health Awareness Month is kind of a good way to get people focused on some of those things. What do you suggest people can do to kind of maintain positive mental health? I mean, you know, to keep ourselves, we always talk about proactively trying to stay healthy. What do we do to keep ourselves mentally healthy?
Yeah, I mean, just like with physical health, right? It's not just I go to a workout class twice a week. It's I'm eating well, I'm doing all these different things. Like mental health is similar, right? It's not just going to see a psychiatrist or going to see a counselor. It definitely can include that. I'm a counselor. I'm going to advocate for counseling all day, but it also includes things like feeling connected with others, doing things you enjoy, finding creative outlets, finding things that cause you to have a sense of meaning and purpose in your life. It can even be things like reading, listening to podcasts, finding mental health resources through Instagram and social media. There's 1,000 ways to do it, but it is so broad, and it impacts our life every day. And I think the pandemic of anything has definitely taught us the role of mental health in our daily life.
Right,
sure.
because that obviously brought a lot of stress in people's lives, and stress can, it doesn't have to, but stress can lead to mental health issues, can it not?
Oh, for sure, absolutely, yeah. I mean, stress in and of itself is a mental health challenge. Like just stress in general, that it affects our physical health, it affects our mental and emotional health, right? Like we're not just mental health in a bucket over here, physical health in a bucket over here, right? We're connected. All of those things are connected and impact each other. So caring for one is supporting the other and vice versa. Same with relationships, right? If I'm caring for myself, then I'm better able to show up in relationships with others, with my community, and vice versa. If my community is moving towards a healthy place, if the people in my life are working on themselves, it positively impacts me as well.
And you're at the Nick Finnegan Counseling Center. I was really intrigued by, it hasn't been around a long time, but talk about why this center was founded and what you all do.
Yeah, absolutely. So we were founded, Nick Finnegan, we were named in memory of him. The Finnegan family lost him in a tragic car accident about several years ago. And they, of course, had to deal with a lot of grief processing, and they accessed counseling and resources that really helped them. And after they had moved through that, they wanted to do something that felt meaningful as a way to, one, remember him and also provide that mental health resource to the community. So they partnered with a local church in the area, and they put together the pieces that helped start what is now the Nick Finnegan Counseling Center. So we're not a Christian counseling center. We serve anybody from any background. We have 13 counselors there, and our goal is really to remove as many barriers to accessing mental health as possible. A big one is finances. So we do a sliding scale. We're a nonprofit, so we do a lot of fundraising. So we have affordable rates, we offer sliding scale, and we also work with a lot of the major insurance companies so people have as many options to make that mental health piece affordable and accessible for them.
And since it is Mental Health Awareness Month, I want to make people aware that you can go to them. I want to make sure that people can maybe call you and you can help them figure out, okay, what kind of services they need and where they may need to go. They're not necessarily with you, but you'll just give them the best advice you can in that regard.
Yeah, absolutely. Yeah, we keep a pretty robust list of resources. So if we're not the place that can provide the help, we always make it a point to try to give anybody who reaches out to us a couple ideas or names or contacts of places that they can reach out. So no one's leaving empty-handed. We also do a lot on social media to provide just free mental health resources that way as well. And we're doing a lot of that during Mental Health Awareness Month especially.
Outstanding. Audrey Olmundson, thank you. We'll be hearing more from you in the weeks and months to come. I've become a huge fan, so we're going to invite you back to talk about a number of issues that I think need to be addressed. I look forward to that. Thank you again.
Look forward to it. Thanks, Kimbrough.
Appreciate you. So we're going to put all of the Finnegan Counseling Center information on the Newsmakers page on click2houston.com so you can access that there and you get a hold of Audrey or someone in that wonderful center.